This broadcast is brought to you by Colby Brooks with Century 21 Right Pace Real Estate and buyfrombrooks.com. Let Colby Brooks handle all of your real estate needs. It's my extreme pleasure to be with you today on NEA Report. Stan Morris right here with you on Friday, June 19th, 2020. It's Friday. We hope you've got some great plans for this weekend. Fun, safety, responsible fun, of course, but we're going to tell you what those plans will, well, at least if you may psychologically be affected by the news, we'll let you know what the plans may include as far as the news go for coronavirus, because we're getting set here in just a moment to hear from the Arkansas governor, and we'll get the latest numbers from him as well. Until then, the first thing we want to do is show you where the numbers are right now, and we've got some updates for you for Northeast Arkansas, too. These are the numbers going into the press conference. Overall, 43, 44 active cases. Arkansas at the moment, I'm going to pull up the map here because Arkansas at the moment is over 200 deaths. Of course, this will take a second to load. Yeah. So 226 hospitalized. That's the number I had on the screen there from yesterday. Let's show you what the global numbers look like. First, in the United States, 2.2 million confirmed cases, 600,000 have recovered, 118,000 deaths. Across the United States is, a lot of the cases that are in the world. Basically, if you look at the confirmed cases, about a fourth of those confirmed cases are from the U.S. Worldwide, 8.5 million with 456,000 deaths, 4.2 million having recovered. Now, I know a lot of you are here for the Northeast Arkansas numbers, so let's get to those, shall we? Here's what they look like, and I actually had to do a double take on several of these counties because the numbers increased significantly for the deaths in several Northeast Arkansas counties. Craighead County has 5 reported deaths as of the latest update, but the active cases have dropped significantly here in Craighead County, down to 56. Greene County at 11 active, still no deaths reported there. Lawrence County at 9 active and 9 deaths on the map as we speak right now. Now, when the governor updates these numbers here in a moment, they will not yet be reflected on the website, but that's what we're going to be watching for later on in the evening. When the numbers are updated online, then we'll have a better idea of where we're at county by county. But these are the latest numbers that we have available. Also, I'm not really sure why I typed in the parentheses twice on all these. Who knows? Randolph County, 29 cases to date, 4 active, with 1 death having been reported there. Just checking that to make sure. Clay County still shows 0 deaths on the map. However, the coroner there confirmed 1 death earlier this week. Makes you wonder how many days these are behind from being updated if they're learning of the deaths, and then it's taking 4 or 5 days for those numbers to be updated. So in Poinsett County, 3 deaths are on the map right now. Mississippi County, 16 active cases with 2 deaths. Crittenden County, 97 active and 10 deaths being reported there. Pretty significant numbers to discuss or to go through there. You know, some significant changes, as we've mentioned, to the death counts. However, active totals in Craighead County going down, so a bit of positive news to report there, obviously, in the midst of some negative. And we're going to be trying to always look for those bits of silver lining with what's going on, because of course this is, as Dr. Shane Spites told me, this is something we're in for the long haul. I told him whenever this started that I had sort of been going overtime on the broadcast, and he said, you may want to slow down because you're probably going to be doing this a year from now. I didn't believe him at the time. I'm starting to believe him because it doesn't look like this thing is ending anytime soon. We've still got about 2 minutes before the Arkansas governor joins us. Actually, 3, and that's if he's on time today, which we have no reason to think he's not. That just sounded snarky, so I didn't mean to be that way. But I do want to show you, as we're sitting here talking, I want to let you know that the John Hopkins map, I want to show you what that looks like if this will load up. Because as we looked at it last time, and it's been a few episodes since we've been here and looked at this, we had showed you the United States was in the top spot of confirmed cases. It's actually not, it's still the United States at number 1, but the number 2, 3, 4, and 5 spots have changed pretty significantly. The number 2 country with the most confirmed cases is Brazil, right under 1 million. Number 3, Russia, with about 568,000, 380,000 reported in India, and 303,000 reported in the United Kingdom. See some of those early numbers we had talked about where Italy was out in the lead, and Spain as well. Well, they still have significant numbers, but they're not at the top anymore. However, a lot of that may reflect testing too. Let us know where you're watching at today. I love giving everybody a shout out. You can probably just hear I open my phone up so I can look and chat. I want to hear where you're watching from, and I want to say hello to you. It's good to see Kenji in chat today. He says, what fear-mongering will Asa and his yes men do today? Maybe people need to be reminded that it's a 97 to 98% survival rate. How about that? Maybe they do. It's good to see you, Kenji. Thank you. I know you're here every day, and we appreciate you for being here every day, even if you're not a big fan of perhaps some of the stuff that gets reported all the time. Hey, we still appreciate you for joining. Melissa is here, and Melissa asks, are the Clay County numbers from a church or a nursing home? I don't have that breakdown with me right now. I don't have the location of the death either, except the coroner, the Clay County coroner had sent that out. You could probably check on the sheriff's Facebook page, Clay County Sheriff's page, and scroll back a few days if you want to look for that release specifically, but I don't have a breakdown of where those cases are at. I'm sorry. Hopefully we'll find out more about that soon. Hello to Kyle. Hello to Ricky, who's watching as well. And saying hello to Richard, who's watching from Hoxie. And Gina's from Reno, watching. And S.L. Robinson joining us from Jonesboro, Arkansas. I know where that's at. Also Marcy joining us in Ava, Missouri. Is that right? Am I reading that right? I hope so. Pretty cool. Sandra says, do you have any info from Mississippi County? Yes, ma'am, I do. And I'll bring that up on the screen for you right now. Now, these numbers came from yesterday, so they'll be changing later on tonight. And in fact, they will technically be changing here in a moment. They just won't update the website till later on. But from yesterday's numbers, Mississippi County had 2 deaths reported, 105 cumulative cases, 16 active cases right now. Good to see you. Bobby says, all just a joke. Hopefully one you're laughing at. I try to have a good sense of humor, but I have a feeling that that's not what you're talking about. Davita says, I'm in Corning, and it's good to see you, Davita. Williams, oh, I went to school with you, I think. How about that? Always cool to see people I grew up with. In fact, I think I was in kindergarten with Davita, if that's who I'm thinking it is. If not, well, it's not the first time I've said something wrong. Francis from Paragould is watching. Tim says hello from Truman, Arkansas. Stephanie Gully watching from Jonesboro. Is Dinah, I believe it is, watching from Gosnell. And Mariah watching from Mark Tree, Arkansas. Good to see all of you today. Hope you're having a fantastic day wherever you're watching from. You got some good stuff planned for this weekend. We know that it's going to be a bit of a warm one this weekend. I wonder what the weather's going to do. Hey Siri, what's the weather going to do for this weekend? Let's see if this works.
Looks good right now, but it might not last long.
Oh, well, okay. You didn't really tell me much more than that, but I thought you might. Clouds on Saturday, a few possibilities for storms Sunday, Monday, and Tuesday. Normally, Siri will read me the forecast. I've always wanted to try to do that while I was live. It's worked every time I practiced it. And, of course, here we are. So it's 1:31 in Jonesboro and across northeast Arkansas. And, oh, yes, Davita said, yes, it's me. Good. So it is my former classmate. Good to see you. Good to see you, Donna, as well as Gail, Garrett, Joanne, and everybody else that's watching us. We appreciate you. Appreciate our supporters, especially 99 cents that keep this news thing happening. We love them. And we're getting set for the governor to show up, and his live feed is already available for us. So I'll go ahead and take that on the screen right now. In fact, I can hear some audio in the room, which indicates to me that the folks are getting ready to walk in and give us a bit of an update. So we'll find out what the numbers are like here in just a short time. Going into the press conference with active cases at 4,344. That was an increase yesterday of 322. The day before, 274. See what the numbers look like today as they increase, because there's the Arkansas governor walking in front of the portrait of the previous governor, Mike Beebe. And he's going to tell us, Governor Hutchinson that is, what the numbers look like right now.
Good afternoon, Eddie.
Good afternoon, Governor.
Good to see you. Delighted to be wearing a mask provided by the Arkansas Nurses Association, and Dr. Smith has it on as well. I'm very proud to be wearing these today and appreciate all the nurses in what they've done. I also just want to draw attention to a historic day, and I've issued a proclamation for Juneteenth, which is so important for us to remember the mistakes of the past, but also celebrating freedom, African American freedom, while encouraging respect for all cultures. Juneteenth is being celebrated in Arkansas, and we're delighted to have this proclamation. Today, of course, we're joined by Dr. Nate Smith. Good to see him today. Secretary of Health. We also have A.J. Geary, our Director of ADAM, that's here. And then we're joined by Representative Carlton Wing, who has been very instrumental in the announcement I'm going to be making shortly, and Ken Kelly, who is the Secretary of the EMT Association in Arkansas, who has been an advocate for the announcement that I will make. Before I do that, I wanted to mention one thing, and that is that the unemployment rate has declined in the month of May in Arkansas, and we have the national unemployment rate, and then we wait for the state numbers to come out. They just came out today, and the May unemployment rate declined in Arkansas by 1.3%, which brings us down into single digits. We're at 9.5%. This means that there's 46,000 more Arkansans employed, exactly 46,378 more Arkansans employed in the month of May, and this is almost 4 points lower than the national unemployment rate at 13.3%. So this is good news for those that depend upon work for their families, their livelihood, and we hope that we can continue to bring more Arkansans back to work. Now, if we go to the first slide, I wanted to express my thanks, and I see Senator Missy Irvin that's here, who both Carlton Wing, Representative Wing, and Senator Irvin has been very supportive of having payments for emergency medical service workers. And as you all know, we've provided some direct payments for our frontline care workers in hospitals through our hospital institutions. But there was a case made that we ought to provide some direct service funds for the emergency medical service workers. And so the CARES Act Steering Committee approved $12 million for EMS direct care worker payments. $10 million was approved directly to the workers, and $2 million was approved for really the payroll taxes part of that side of it. And these funds will be distributed to the employer, important to remember, who in turn distributes the payments to each employee according to the number of hours that they've worked. And this will impact 5,053 workers in Arkansas who are licensed as emergency medical technicians or paramedics, and they will be eligible for these payments. And they will be for the time period beginning April 5 through May 30th. And if you go to the next slide, you can see how it will impact each one of those. It's for those who work at least part-time, 20 to 39 hours, $125 amount per week. And then if they work 40 hours or more, they'll be getting an additional amount in their paycheck as well. And so these will be a real recognition of the risk that they have taken and the service that they have provided. Because as you remember, particularly in the early days of the pandemic, when they were called out to pick up someone or emergency medical situation, they didn't know what was going to be behind the door or with that patient. So they were putting themselves at risk, and we're grateful for their service. And Ken, if you would come and make a comment. And again, let me thank the General Assembly today approved this money. And we thank you for that through the ALC, Senator Irvin, and Representative Wing. Ken?
Certainly. Thank you, Governor Hutchinson, and those present here today, Secretary Smith and Representative Wing and Senator Irving. We appreciate very much this opportunity to be here to represent your emergency medical services system. Today I'm here primarily representing two groups, the Arkansas Ambulance Association, which represents the ambulance service providers, but more importantly the Arkansas EMT Association, which is the direct representative body for the boots on the ground, the EMTs and the paramedics that serve our communities every day. As the governor went over some of the numbers, you heard 5,000 some odd professionals that respond in our communities. Our communities very much depend on emergency medical services, not only for the time-sensitive emergencies such as heart attack, stroke, trauma, and other things, but also a continuum of care bridging the pre-hospital emergencies and medical care to our hospitals and our long-term care facilities. So we are very pleased that the state has taken this action and thank all of those that have been out there on the front lines. We cannot do what we do every day as ambulance providers without our EMTs and paramedics, and we're very proud of what they do. And with that, I just want to say thank you, and this is a great day for EMS in Arkansas, and we are ready today, and we are prepared for tomorrow.
Thank you, Director. And I would remind everybody who's listening who will be the beneficiary of these payments that it has to be processed through DHS to the different employers, and then the employers will process it out. And I've learned when it came to our hospital workers that takes some time through that process. And so you can count on it, be patient, and we'll be getting that money out. And then that brings me to the cases for today. Yesterday we had 13,928 cases in Arkansas. Today we have an additional 703 cases statewide. Of these, 41 are in corrections, which means that this is the largest growth of community cases that we have seen in a single day. That brings the total to 14,631 cases in Arkansas. And I know Dr. Smith, when he comes, will elaborate as to where we see the transmission and where these cases are coming from, which if you look at the counties, it's really the same sources that we've seen in previous days. Washington County, 136 cases. Benton County, 112. Pulaski County, 53. Sevier County, 44. Sebastian County, 26. Faulkner County, 22. And Yell County, 21. The rest of them are less than 20 cases. And so you can see where the concentration of new cases are. And we are continuing to deal with that. We don't, whenever we see new cases, we implement the strategy for contact tracing, for contacting these individuals, for isolation to prevent that spread. It is a lot of work. It is a lot of running these cases down, and I'm delighted that Dr. Smith will be able to talk about the CDC and their work in Northwest Arkansas as well. In terms of hospitalizations, we've had an increase of 5, which brings our hospitalizations to 231, and we have 6 additional deaths, brings that to 214. We conducted over the last 24 hours 5,167 tests across the state, and the important statistic is the overall positivity rate. The overall positivity rate that we've seen is 6.5%. Since we started the pandemic, we continue to monitor that. And if we go through the graphs, you can see that, again, this is the largest day of the orange, which are the community cases in a single day, even though this is not the largest day of total cases in a single day. And then if you go to the rolling graph, you can see the up and down, and obviously whenever you have a 7-day rolling average with this spike that we see today, that means that over the next 7 days you're going to see that trend line go up some, and it's going to take us a while to get that back down. You go to the next slide, you'll see this is the rolling average, as I mentioned, of positive cases in Arkansas, which is again a new graph that we're starting to show from time to time. 10% is, of course, the CDC guidelines. We've largely stayed underneath that. Our 7-day rolling average stays underneath that, and the latest positivity rate is about 7%, even though we're really targeting our testing to a large extent through our public health department. And then if you go to our next slide, we'll see that we're on target for the month of June, where we set a goal of doing 120,000 tests. We're at 92,275 tests, and it will be continue over the weekend and through the rest of the month. And then finally, I wanted to talk about face coverings. And Dr. Smith, at my request, is issuing, and with the support of the public health team, the Department of Health is issuing new guidance today in reference to face coverings. And based upon the above data that is cited, and we wanted to really lay this out for the public as to the reasons that face coverings make a difference. And so that's articulated in the guidance, and they make the following recommendations, and these are the highlights of it: that face covering should be worn in all indoor settings where you're exposed to non-household members and physical distancing of 6 feet or more cannot be assured. Very, very important. And then in outdoor settings where you're exposed to non-household members, you should wear face coverings unless there is a space of 6 feet or more that you can practice physical distancing. And then it goes on and describes that cloth face coverings have been shown to be sufficient for the general public and effective in preventing transmission. And it describes very clearly as to how the covering should be worn to protect against that transmission. This is important guidance for the public. Now, just so there won't be any confusion, this is the same type of guidance that we give to our houses of worship, which is the best practices that they should implement, but it's not a directive in which carries a civil penalty with that. And that is an enforcement issue, but it's also, when it comes to churches, is recognizes that separation of church and state. But we provide that guidance, and by and large, churches have adhered to that. We're asking the public in the same way to follow the recommendations of the Arkansas Department of Health, and this will be posted on the website today. And this is an important additional announcement that we're making today to help guide that. And I encourage everyone to really look at some of the case studies that are in the guidance and references the scientific literature that shows that when face masks are used by 50% or more of by a majority of the population in public settings, then it is effective in starting to reduce that transmission. And so help us out, follow that recommendation, and it'll make a difference as we go through this. With this, Dr. Smith.
Wow. All right. So the governor's live stream just went offline, and you could literally see live stream offline on the screen at this very moment. So what we're going to do is exit out of that, and we will see if I can maybe take KARK's live broadcast of this. Interestingly, we heard of a large increase today, and if you're just joining us, those numbers increased by the second highest number that they have yet in Arkansas. 703 new cases reported today in Arkansas of COVID-19, 14,631 cumulative cases to date. Now, out of those cases, we don't know the active total. We didn't get that just yet, but yesterday's active was around 4,300, so that would likely mean with the average 2 to 250 recovering a day, we're probably looking at about 4,800 active, but don't quote me on that. We'll get the exact number here in just a short. Looks like this is being streamed by KARK at the moment, and so I should be able to pull this up, and we will take them live here in just a second. Appreciate everybody for being patient. Don't know what happened to the governor's live stream there.
And so
we have 3,892
active cases in the community.
But at the moment, the governor actually did finish giving us those initial numbers, and so we have the breadth of what the press conference was already.
Cases,
Still
bringing our total to 569
Let's see if we can get. I may have the audio.
21 new nursing home staff who have been infected, so that's a total of 389 nursing home staff. The governor mentioned we've had a net increase of 5 hospitalized, so we're at 231 hospitalized. Of those, 57 are currently on a ventilator. That's up 4 from yesterday. We've had 6 additional deaths, so we're at 214 deaths total. We have 9,712 who have recovered, and that's up 336 from yesterday. The governor has mentioned the good progress that we're making on testing. We are well on our way to actually exceeding our goal of 120,000 tests for the month of June. I just want to give a special recognition to the public health lab. 993 tested 993 individuals yesterday. So that is the most that the public health lab has done. The governor has mentioned masks. There are things that we know that do work to limit the transmission of COVID-19, and one of those is face masks. We're putting out this guidance. Unfortunately, face masks are oftentimes underutilized for that purpose, for limiting the transmission of COVID-19, and sometimes misunderstood. The mask I wear protects you, the mask you wear protects me. When we all wear them together, we protect each other. One of the stories or cases that's mentioned in our guidance is a situation in Missouri where a stylist was infected with COVID-19, but because they wore masks in the setting, both the stylist and the patrons, there were no additional cases. No transmission occurred in that worksite setting. We've also seen that at the Arkansas Department of Health. We've had a number of our staff who have tested positive, but no transmissions in the work site because of the physical distancing, because of the wearing masks, etc. When we're looking at our spike of over 700 total cases today, we look back and we see last Friday we also had a spike of over 700 cases. I don't have enough information on those to tell you exactly where each of those individuals acquired their infection, how it was transmitted, but when you see a weekly pattern like that and you go back the 5 or 6 days of the average incubation period, at least there's a suggestion that what's happening on the weekends is having some bearing there. So we have focused a lot of attention on work sites, which is good and appropriate. We need to continue to do that, but when it comes to the weekend, people can't let their guard down in terms of attending large events, not physical distancing, and especially not wearing masks, because then we can see transmission in those settings. And one of the settings that I want to particularly point out are places of worship, and those are very affirming, important parts of the community's activity, and they can be done just as safely as we can in work sites, but we need the same precautions. We have a list of about 25 places of worship so far where we've had one or more cases, not necessarily transmitted in that place of worship, but people who were in. This is something that we need to look at very carefully if we want to limit the spread of COVID-19, especially on the weekends. We're also continuing to look at hospitalizations very carefully, making sure that no hospitals have an excessive number of cases. The largest number that we have in any one hospital is 33, 18 ICU and 9 ventilator. So we're continuing to monitor that situation carefully. And the last thing I wanted to talk about was our CDC team. They continue to work in the northwest part of the state, Benton and Washington counties. Among the activities that they're doing, specifically they're mapping those transmission networks so we can get a better idea of how to interrupt those chains of transmission. They're able to do a deeper level of analysis than we're able to do in real time as we're doing our contact tracing, and we expect that to be very valuable to us. They've indicated at this point they plan to be there for about another 2 weeks. With that, I'll go ahead and turn it back over to the governor.
Thank you, Dr. Smith. I did want to recognize Dr. Jose Romero, who will be coming in for Dr. Smith in the coming months. With that, we'll be happy to take any questions.
I have a question for Dr. Smith. There was a report on National Public Radio today. It wasn't their own research, but they cited research saying that Arkansas needs 1,600 contact tracers based on our population. Is there any way to actually reach that number here?
there have been a number of different ways of calculating how many contact tracers that we would potentially need. An earlier report had said over 900. It really comes down to the strategy that you're using for contact tracing. Some states, they're using fairly low-level trained individuals, more like community health workers, and they will need a lot. We are finding it more useful to have people with a higher level of training, and also using software. Our Sarah Alert software can help us in that as well. Also partnering, for example, with educational institutions and with work sites to enable us to help us with that contact tracing. I don't think we'll need that many, but we'll continue to grow our numbers to meet our needs.
Do you think, if you could have what you want?
Well, you know, part of this is not trying to see where the puck is now, but where the puck is going, and anticipating how many active cases that we're going to be dealing with a few months from now. It's difficult to know. We've had our ups and our downs with that. Certainly the 350 that we will be adding as part of the CARES Act Steering Committee will more than double our contact tracers, and that will help, and in particular it will give us people who are specifically trained to do that work and equipped.
Jake?
I guess at this point, why not just put out some directive for mask wearing? Maybe not just a blanket, you have to wear one all the time, but why not implement some of that more so into the community, especially if, as Dr. Nate said, you know, we're seeing this as being a problem of being out and about on the weekends.
Well, my experience with Arkansans is you give them information, they will make good judgments. We're trying to give them good information so that they make good decisions in terms of public health. It's also an enforcement issue. And you know, today I had an email from someone who traveled through Arkansas and went to a particular restaurant and said only 2 of the wait staff were wearing masks, and asked us to enforce our directive, which is appropriate. Filed a complaint, and so you know, we'll have someone from the Department of Health go out and look at enforcing that. So I think it's most important to use enforcement resources for where our directive is in place in terms of restaurants and other businesses, because those are directives. But this is not what you want to see in Arkansas, that you're going to be having people call the governor's office and say, I saw John or Jane Doe out on the street, they didn't have a mask. You know, and so if you're going to make a law or a directive, and that's what a directive is, then it makes it's not good policy not to have the ability to enforce, or the fact that you know, it's going to really make the directive illegitimate to begin with. So that's the reason that when it comes to individuals, it is guidance that we expect and want people to follow. And that's the reason that because we had the guidance in many different places and we pulled it into one and made it more clear. Hopefully it'll have a greater impact with Arkansas. Yes?
Is there any other location where you would consider making it a directive, like a grocery store or a big box store?
That's a good question, and we've already done that in terms of some of the face-to-face businesses. There are directives as to how they reopened, and this was put into place in terms of face coverings being a part of it. You know, we do have that in place in terms of workers in some of the essential industries, but you know, from a public standpoint, we have maintained with this guidance. We continue to evaluate what works well, and if we need to make adjustments down the road, we can make adjustments.
I guess again, sort of in response to Fayetteville and now Little Rock putting out their mask orders and things like that, how would that differ maybe from cities putting curfews in? It's something that they feel that our city should do this. I'm just kind of curious as to what the difference between the two might be.
Well, we gave, under our original emergency powers, we gave authority for cities to coordinate with us in terms of curfews. we still have that same policy. If they coordinate with us, we'll see if it is in conflict with our general guidance. But it's important that the public have one general guidance on this issue, and it should come from the Department of Health. We have provided that guidance, and if there is something that's consistent with that, that's not more restrictive or goes against it, then we'll have that conversation with particular city. I've not seen that push. I've talked to a lot of mayors. I was in Fort Smith yesterday. They support this guidance that we're giving from the Department of Health. Is there a question that is remotely?
Governor, what is your position on the removal of the Confederate statue from MacArthur Park? And do you have any thoughts on the 2 Confederate statues on Capitol grounds in light of that?
The question is in reference to the Confederate statues that are on the Capitol grounds, as well as in MacArthur Park, that was removed by the City of Little Rock. In terms of the City of Little Rock, is a city decision. The mayor made that decision. Our Department of Parks, Heritage, and Tourism actually had an easement on part of that, and we're having to work through that issue with the city, but we'll also be working with the city to see where an appropriate place for that statute to be. Secretary Hurst has the lead in that, and she is coordinating that effort. In terms of the state capitol, that's a matter of General Assembly. We'll have to address that, and so it's not something that can be really considered until down the road, and that's the will of the General Assembly. Yes?
What do you think should be done with the statue that was in MacArthur Park?
What should be done with it? Well, it should be put in an appropriate place where it can, be respected, and one of that's been suggested is the Confederate area of the National Cemetery, and so that's one of the things that's being considered. But that's something that we want to coordinate between our Department of Parks, Heritage, and Tourism and the city.
With the emphasis on masks and kind of what you're saying today, do you still have, are you still seeing the same thing in terms of this not being transmitted in restaurants and other locations like that have been able to open up? And if not, then where in the community is it being transmitted?
And we look at that very closely, and so, Dr. Smith mentioned churches today. But in terms of restaurants and others, we don't see a correlation between the increase in cases and the lifting of restriction in those areas. But Dr. Smith, if you would come and comment on that more specifically.
Certainly. I think where we're seeing transmission is in any places where people are gathering and they're not maintaining physical distancing or wearing masks. And I think from community to community, that can differ. Part of what we're hoping that our CDC team will do is, as they map out those transmission networks, we will get insight into, in those communities that are being hardest hit with COVID-19 right now, where is that happening? Now, for those of us living in communities, we probably have that knowledge without having to have a CDC team come and map it, and we shouldn't wait until we have COVID-19 increasing in our communities. We should use the knowledge that we have. Don't gather in large groups where there's no physical distancing and no wearing of masks, because those are the areas, that's the setting in which COVID-19 spreads very, very rapidly.
With the protests at the Capitol and also?
I think any gathering that meets those criteria, you get close, you're breathing each other's air, no masks, that's a potential. The virus doesn't matter what the purpose of the meeting is. On the other hand, if people gather and they maintain physical distancing and they're wearing masks, we've seen in many settings that the spread of COVID-19 in those settings is limited or non-existent.
Is there another question remotely?
Governor, this is
All right, the First Lady.
Governor Hutchinson.
Hi, Governor. Go ahead. This is Allison with 4029 News. You touched on this yesterday, but is there anything enforcement-wise that your administration would consider with ahead of President Trump's rally in Tulsa to ensure that any Arkansans who are traveling there do quarantine when they return, or any Oklahomans who may be traveling to our area afterwards, follow those guidelines?
Well, let's wait and see. This is a real test as to how the rally is conducted. From what I've seen, they're trying to follow CDC guidelines, screening, and I hope the mask wearing and the social distancing is a part of that rally. And to me, that's a very important part in terms of the public health. What I've said is that if an Arkansan, I'm sure there'll be many Arkansans that will go over for that rally, that if there is not appropriate social distancing, wear a mask. And if you don't do that, then I hope that you will have a test when you come back, because we don't want that to contribute to the other challenges that we face in the state. And then there one other lady on the remote.
Yes, this is Clarissa with KNWA in Fayetteville. As you probably know, Kansas has put Arkansas on its quarantine list. What are your thoughts on this, and do you think other states will follow suit?
I actually thought it was a little odd. I looked today over lunch at comparing our cases with Kansas, and there's really not a great deal of difference in the number of cases that each state has. But regardless, that's the decision that the governor made, and I don't see it having a great impact on Arkansas. Obviously, people from New York and all over the country can travel here. They're coming to our great state parks, and I guess we'll miss a few Kansans that might not be able to come here because of that. Jake.
I've seen some social media sort of firing up, obviously today being Juneteenth. Would this be something, a day that you would be in favor of making this a state holiday?
Well, it is a very, very important day in our history. It needs to be celebrated. It needs to be remembered. As to whether it's a national or state holiday, that's an issue that I'm not ready to embrace yet, just simply because a state holiday is, another, if you're going to substitute it for a different holiday, but there's a limited number of holidays that we can have. And of course, we have Dr. Martin Luther King, which is an important holiday. And so the question is more of are we going to have a new holiday or substitute it for an existing holiday? And I don't think we're ready to embrace that yet. Yes.
There's a survey taken by Harvard University around the country that shows, indicates support for vote by mail in Arkansas. And we now have models that suggest a huge rate of infection at the end of September that Dr. Patterson's been addressing because it predicts such a high number of people in the hospital. So given that information and the fact that it takes a while to prepare, are you at all amenable to changing your stance on no excuse mail-in ballots in the general election?
Well, let me be clear on the distinctions in terminology. You have, of course, your vote by mail, which has not been embraced in Arkansas through a legislative standpoint. But in terms of no excuse absentee voting, that is something that we utilized in the special elections, and certainly is something that we ought to consider for November. If we still have the pandemic then, that's a health precaution. It allows voting in different ways, but it also has security measures in place that the legislature has established for identity of a person who will vote absentee. And so voting absentee is different than simply a vote by mail protocols. And I'm waiting to hear from our county clerks as to whether they're requesting action on my part and the State Board of Election Commissioners as to what relief they need as we prepare and look at a November election. They gave me counsel, they gave suggestions as to how we should do the special elections, so I'm anxious to hear from them as to what measures they think need to be taken. Jake?
Yesterday, Dr. Ken Patterson testifying over there at Big Mac said their modeling had potential for end of September into October at 50 times what we're currently sitting at in terms of hospitalizations, cases, all of that. Kind of what's your reaction to hearing that potential?
Well, of course, I've looked at that. I get that report every week, and the modeling, is a mathematical equation based upon certain criteria. We want to change the facts that go into that, which is the contact tracing, the isolation, the work that we're doing day in and day out. And so with that, I expect to beat that modeling projection, but you also prepare for a worst case scenario in the event that would happen. And one thing we know is this virus is unpredictable, and I'm not going to try to predict what it's going to be like in October, but prepare for any circumstance. And I do want to invite Dr. Smith if you have a comment on that modeling.
I really do appreciate the predictive models that have been out there, both the ones that have been generated within our state and the ones that others have done outside of our state. This pandemic, though, has proven to be very, very challenging to model mathematically, and there's been a lot of twists and turns. We've had here in Arkansas really more ups and downs, driven more by local clusters and regional upticks rather than the type of uniform growth that a mathematical model would predict. So we'll keep looking at those models, but I think with COVID-19 especially, we need to look at our data and see what's happening and what we're doing about it, and that's probably will guide us more accurately than trying to project out weeks or months ahead.
Is there one more question remotely?
Yes, Governor, good afternoon. It's Neil Gladner in Hot Springs. Thank you. I want to go back to the answer about the rally and put that in the context of any other congregate setting, so not just the rally. And if I heard you right, you said you hoped if Arkansans went there and found people not social distancing that they would wear masks. But if I go back to what Dr. Smith said, that I wear a mask for you, you wear a mask for me, I'm not sure I'm clear about how wearing a mask in a congregate setting without social distancing helps protect Arkansans.
Well, it does. If everybody's wearing a mask, then you're going to avoid the spread of COVID. And so that's one of the things in our recommendations, our guidelines that we presented today, that if you can go outside and you can stay physically 6 feet apart from someone, then there's not a requirement that you wear a mask. But if you have to get within that 6 feet, then you need to wear a mask. And if there's any doubt, wear a mask, face covering. But to me, there's if you have a larger gathering, you ideally would do both, but at a minimum, you would do the face coverings if you cannot physically distance. And Dr. Smith, you haven't commented on that. Do you want to say a word about gatherings like that?
Certainly, it really depends on how it's laid out. If people are able to maintain 6 foot distance and there's good air circulation, then wearing a mask, would be optional. It would add relatively little to the protection against COVID-19 transmission. However, when you get into large groups like that, oftentimes it is difficult to maintain a consistent 6 foot distancing, and it would be wise to add to that by wearing a mask as well. Again, the masks are primarily for source control. My mask protects you, your mask protects me. There is some emerging evidence, though, that there is some level of protection, certainly not 100% for the wearer as well, so that's an added bonus. But if I were going to go to a large gathering where I wasn't absolutely sure that we were going to be able to maintain that 6-foot distancing, good air circulation, etc., I would go ahead and wear a mask.
Governor, will there be an impact on the reopening of schools in the fall if the state's public health emergency status is extended again?
Well, of course, the public health emergency will very likely extend into the fall. Even though we extended it 60 days now, which takes us, I think, into August, it very likely, under the current circumstances and projections, will extend in the fall. But just like you work during the pandemic, you go to school during the pandemic. So I don't see that as an impediment to having school this fall. Thank you all very much for today, and have a great weekend, by the way. We'll reconvene on Monday.
So the governor letting us know some interesting stuff today. First of all, that he says he cannot get behind a Juneteenth holiday because we've already got one like MLK Day. What a statement to have made. Several other statements there to unravel, and to be honest, we'll leave most of those to the political commentators. But what we will tell you is that we found out 703 new COVID-19 cases were in Arkansas, or classified in Arkansas, over the past 24 hours. 231 hospitalizations are the numbers of hospitalized right now, the latest numbers that we have. 214 is the number of deaths. New mask guidance was issued by the Arkansas governor stating that he wants Arkansans to make good decisions. And he says whenever he gives Arkansans good information, they do make good decisions. It doesn't really explain why we have seatbelt laws or texting while driving laws, if that's the case, but he will not, on that logic, issue a mandate to wear masks or a directive, because he wants us to make, quote, good decisions. And hopefully we will do that. Thanks, everybody, for joining us on NEA Report. Stan Morris reporting in Jonesboro, and you're up to date. We're back with more news from Northeast Arkansas throughout the weekend. If it breaks out, that's when NEA Report breaks in. Have a good night.